Hi, this is Dr. Michael Newman from South Bay Plastic Surgeons, and today we're going to show you how to empty your drain. Drains are a very common part of any type of surgery, and usually they're in place for anywhere from 1 week to 4 weeks. They're common in reconstructive surgery and also other types of cosmetic surgery, abdominoplasties, etc. Today specifically we're working with a breast reconstruction patient, and we're going to empty the drain and show you how to do it. So the first step, of course, is to wash your hands. Make sure you have kind of a clean environment. I'm using gloves, although you don't have to. You can use your bare hands. The next thing you'll need is some kind of cup in order to measure the amount of fluid that comes out. There are cups that have numbers on the sides, and those are the measurements that we prefer to use. Either cc's, which is cubic centimeters, or mLs, which is milliliters. Those numbers are equivalent. We prefer not to use ounces as much because they're not quite as precise. Now sometimes if there's a lot of drainage, it might not fit in a small cup like this, so you can put it into a bigger cup and then measure it out into the smaller cup later. But in this case we've got very little output, so we're just going to measure it directly into this small cup. So we'll go through a step-by-step process of how to do this. This is a JP drain bulb here. And what we do is just take the top of the drain cap off, and you can see it expands or pulls in the air into the bulb, and then just tip the bulb over to get that fluid to leak out, and sometimes squeeze it a little bit to help that fluid. We're going to put this cup over here on the side for a minute and put it down, measure it later. And then the important thing is that when you reset the bulb, you need to squeeze the air out of it so that it allows some suction to develop. So squeeze the air out and then replace the cover or the stopper on the top of the drain. So now the drain is ready to continue working and removing any fluid that builds up in the body. And the next step that we're going to do is measure the amount of fluid in the cup. So if you look over here with me, you can see that this cup has some fluid in there, and looking at the numbers, it's about 5, maybe 6 milliliters or cc's on the side there. Got a little bubble, but right around 5 or 6 milliliters. And so we'll record that on a drainage sheet, and it's important to bring that record of the drainage output to your doctor when you see him or her, in order to decide when the drain's ready to be removed. And so over here on this record, what we will want to do is include the date and the time that the fluid was removed. So specifically under the column where we have drain 1, which is the drain that we emptied, we're going to put the time, which is 11 a.m., and the amount of drainage. And so we'll put 5 milliliters. And so that will keep track of how much fluid comes out. And on our drainage records, we typically like to have an area that you can add up the total amount for a 24-hour period, which helps identify whether the drain is ready to be removed when you come into the office.
Okay.
So after you record the output from the drain, then you want to discard the drain fluid, and you can either discard it in the toilet or a sink, and then just wash out the cup so that it's ready for its next use. Now regarding care for drains or complications with drains, typically the drains are secured with a stitch. Now sometimes the drain might get dislodged or fall out with moving around if that stitch comes out. If that happens, it's not an emergency. Typically you can just put a little ointment, bacitracin or neosporin, over the drain site, and then let your doctor know, usually the next day, so that they're aware of what happened. Sometimes the drain can leak either around the drain itself, the drain site. If that happens, then you can reinforce the area with some gauze typically, or you might have leakage from the drain bulb itself if the cap came off or something like that. If it's spilled somewhere, then you would lose track of the output, But once again, it's not an emergency, just start recording from that point on. Hello there, so this is Dr. Newman here from South Bay Plastic Surgeons, and we're going to be filling an expander today, adding some fluid to make the expander a little bit bigger. So just to give you a little visual, what we're going to do is take an expander like this, which is in our patient here, and it has a little metallic port or valve on the inside, and so we'll be using a needle to access this port and add some fluid to make the expander a little bit bigger in anticipation of later taking the expander out and putting an implant in. So we're going to walk through this process. And the first step is to find where the port is on the patient. Now, just to let you know, this does not hurt, usually in most patients, and you'll notice that during our process today. But we're going to walk you through each step just so you know what to expect. So the first step is to take this little magnet and identify where the port is, because it's metal. So once we identify where it is, then we'll mark it with a pen. Now that we know where the port is, we'll clean the area in order to create a sterile environment, in order to make sure that we don't create any problems like infection. So we'll put some soap on, which will cleanse the area and get rid of any bacteria. And then the next step is we'll take this syringe of fluid and this small needle and use it to access the expander. Now some patients might feel a little spasm or twitch of their muscle as the needle goes through the tissue, but usually there's no discomfort. And what we do with our expanders is we add some blue dye in the expander so that we know when we put the needle in that we're in the right place. And so you'll see as I draw back some fluid, that fluid comes back blue, confirming that we have actually accessed the port in the right place. So now that we know the fluids or the needle's in the right place, we'll add fluid. People can have a little discomfort over the few days after this filling, just maybe some soreness typically, because that extra fluid puts a little pressure on the muscle. But typically people do not have any pain with the expansion process. Now this is in contrast to the way reconstruction used to be, where expanders were placed under the muscle without any dermal allograft or any support. In those cases, expansion used to be painful. But now that we're able to use that dermal graft or some other kind of mesh support, it allows the muscle to stretch without any pain. And that really has revolutionized expansion for us. So let's take one more.
Mm-hmm.
So then we added 50 cc's already. This is another 50, so it'll be a total of 100 cc's of expansion, which is pretty typical for an expansion episode. And then after that we'll take the needle out and we'll wait till the next visit to decide if we want to do any more expanding. Typically our patients go through I'd say an average of 1 to 3 expansions. Fortunately we're able to put most of the fluid in the expander at the time of surgery, and then after surgery we just adjust things, mostly for symmetry or to get the volume that we want or that the patient wants. Can I have a piece of gauze, please?
Mm-hmm.
Thank you.
Mm-hmm.
So then we'll just take that needle out. And that's it. And that's the end of expansion.
I'm about to take a shower, and this is just one way that you could put your JP drains. I actually have a lanyard here where I clipped it and make it easier for someone to take a shower and that it's out of the way. And by the way, the lanyard is donated by Evelyn's BFF.